The Pathway of the Median Nerve and Risks for Injury by Robin Enlow,
Abby Privetti,
and Jesse Harder.
The median nerve pathway. At the brachial plexus, the median nerve comes from the spinal roots of C5 through T1. It comes from the the anterior medial and anterior lateral cords. If you think back to the brachial plexus model, this would be the middle part of the M. Traveling down the upper arm, the median nerve lies close and lateral to the brachial artery until the cubital fossa. It passes over the brachialis muscle and between the two heads of the pronator teres. In the forearm, it runs between the flexor digitorum superficialis and the flexor digitorum profundus. And then in the forearm, the median nerve also splits into two branches: the anterior interosseous nerve, which innervates the deep anterior forearm muscles, and then the palmar cutaneous nerve, which is cutaneous innervation or skin of the lateral palm. And then at the carpal tunnel, the median nerve runs deep to the transverse carpal ligament. This is the median nerve. As you can see, it's coming down. It splits off into the anterior interosseous nerve, which goes deep, and then it continues down. Once it reaches the palm, it splits off into the palmar cutaneous nerve, which supplies the skin of the lateral hand, and then it also runs up the fingers. The picture on the left shows the median nerve, and it also shows the two branches. So you can see it has the palmar cutaneous branch and then the anterior interosseous branch. And then the picture on the right shows how the nerve runs through the carpal tunnel with all of the tendons. Median nerve innervates the muscles of the forearm and some muscles in the hand. The forearm superficial layer muscles are the pronator teres, flexor carpi radialis, palmaris longus, flexor digitorum superficialis, and then deep to that, which is supplied by the anterior interosseous nerve, it innervates the lateral one half of the flexor digitorum profundus and the flexor pollicis longus and the pronator quadratus. Some other muscles that it innervates are the abductor pollicis brevis, superficial head of the flexor pollicis brevis, apponens pollicis, and lumbricals of the hand, which are only the fingers 2 and 3. It also innervates the skin of the palmar surface, lateral palmar surface.
risks for injury due to the median nerve. The first one can be a supracondylar fracture of the humerus or a fouche. Also, irritation or inflammation of the muscles, the flexor digitorum profundus and the flexor digitorum superficialis can put pressure on the median nerve, causing it to become injured. Also, another risk for injury is a subdermal implantable contraceptive. And the last risk for injury is the pronator teres syndrome, which we'll go over later on.
So one rare cause of median nerve injury is the subdermal contraceptive implant, or SCI. Typically, this implant is quick and easy to insert and remove. 1 minute insertion time and 2 minute removal makes it very popular. And adverse events are typically very rare. An adverse event during insertion has less than 1% chance, and during removal is a little bit higher at 1.7. We found a few case studies, but especially one in particular where a patient had experienced pain for 2 months prior and immediately after the attempted removal of her contraceptive implant. It is believed that her implant had migrated in her arm. An ultrasound was used as the doctor attempted to remove it, but eventually they need to make an incision, and the implant was successfully removed. Following removal, the patient experienced pain, tingling, loss of grip and wrist flexion strength, and limited motion in her thumb and index finger. Removal had affected both her median nerve and her anterior interosseous nerve, and she had 0 out of 5 strength in her flexor carpi radialis, flexor digitorum superficialis, and flexor pollicis longus. After 6 weeks, she had gained some of her strength back.
Risks for injury of the median nerve include overuse of the motion in your arm or hand, such as knitting, writing, or typing. And also, the top right picture can be due to a fouche, falling on an outstretched hand. Some symptoms that a patient may experience if they have a median nerve injury is tingling and numbness that can happen on the lateral side of the palm, the palmar surface, and the fingertips of the lateral 3.5 digits as shown on the bottom picture. They also can experience pain or poor grip strength due to atrophy, which means the muscle is becoming smaller because it has decreased movement. And also the thenar muscles experience motor function loss, so they can become atrophied as well. Someone with a median nerve injury can also experience stiffness and lessened flexion within their hand on the lateral side, and this is called the claw of benediction. And this is the picture shown on the left side.
Carpal tunnel syndrome involves pressure being placed on the median nerve as it passes through the carpal tunnel. You can see in the picture on the right that carpal tunnel is under that transverse carpal ligament, and that median nerve can get compressed right there. And this is commonly due to an inflammation, so muscles in that surrounding area can become inflamed and compress on the median nerve.
These 3 muscles are the superficial muscles on the anterior forearm. This is pronator teres, flexor carpi radialis, and palmaris longus. The deeper muscles underneath these muscles are the flexor digitorum profundus and the flexor digitorum superficialis. All these muscles are innervated by the median nerve, which is right here. The pronator teres syndrome can happen when the median nerve is compressed around the muscle over here, which could cause pain or tingling for the client.
All of these muscle tendons converge into the wrist. The transverse carpal ligament crosses over these fibers and the median nerve in the wrist. Carpal tunnel syndrome arises when the median nerve is compressed under this transverse carpal ligament. Carpal tunnel syndrome involves compression of the median nerve and therefore will have similar symptoms as previously discussed. Just to reiterate, in digits 1 through 3 and half of digit 4, numbness, tingling, burning, and pain can occur, and an individual may also experience shock-like sensations in these extremities. This pain or tingling may also travel up the forearm. Symptoms can also be demonstrated by dropping objects due to fine motor skills deficits.